Right on the front line when the first wave of COVID hit, it is little wonder that doctors and nurses were described as heroes. Not one, though, would claim to be superhero. Many are now finding it hard to cope as the second wave rolls in.
Because you're trying to show your face that you're the tough one there, but inside you're also scared.
Laki Yassin describes how she feels working on the acute COVID ward at Milton Keynes University Hospital. She still bears the emotional scars.
They don't have their families there. They're so scared. We have to provide them with their emotional support, as well as we want to treat them before they get worse. So we all have to balance the medical part of it and the emotional part of our patients. So it's quite draining for us.
Laki uses a new wellbeing hub to de-stress. A third of her profession say they feel burnt out, and it's not just those working in hospitals.
This doctor's surgery may be empty, it may appear calm, but despite that, doctors say they are under huge pressure, having to diagnose patients virtually, to deal with staff shortages, to get through a massive backlog of patients who just need routine checkups. And then, of course, there's the worry about patients who perhaps should be seeing a doctor, but are too frightened.
It's just there all the time. We feel exhausted, mentally, physically, emotionally.
Dr Karki's a GP in North London. He fears the winter pressures as well as COVID will be more gruelling than the last 6 months.
All I can do is sit for hours and my mind is whirring, or I'm on my phone, or I'm just sitting in a place trying to get some peace and quiet and switch off from the world. And I think that's a worrying place to be. And I know I'm one of many who are like that.
The government's promised to boost mental health services for NHS staff, but MPs questioning NHS England pointed out stress was endemic before COVID even hit.
Do you accept that shortages of doctors, nurses, midwives and other frontline workers contributes to burnout amongst staff?
Yes. Even before the pandemic, shortages and rising demands in services were both contributing to stress.
The government says money is there to help. For many, it can't come soon enough. Emily Morgan, ITV News.